Bold statement: infectious diseases in older adults are too often treated as a roll-the-dice risk rather than a solvable, preventable problem, and that mindset must change. The following rewrite preserves the original meaning and key information while presenting it in a fresh, expanded style that's easier for beginners to grasp. Preventing infections in older people requires more than routine efforts, it demands a consistently high standard across the healthcare system. England's Chief Medical Officer, Professor Chris Whitty, argues that current strategies to prevent and manage infections in the elderly are often a hit and miss, and he calls for a stronger, more systematic approach backed by research focused specifically on older populations. In his annual 2025 report, Whitty highlights the long-running progress in reducing infections and extending life expectancy over the past 150 years. Yet he emphasizes a gap: there hasn't been enough targeted research into infections that disproportionately affect older adults, a demographic that is growing as life expectancy rises. Whitty pointed out at a press briefing that while society is very systematic about minimizing infections in children and young adults, the same thoroughness isn't always present for older adults. Data from England for 2023 show that most deaths from infectious diseases occurred in older people, with respiratory infections and COVID being the leading culprits in this group. Dr. Thomas Waite, the Deputy Chief Medical Officer, defended the decision to raise the age threshold for COVID booster eligibility, while Whitty emphasized prioritizing other vaccinations for older adults, including a new vaccine against RSV. The issue goes beyond preventing hospitalizations or severe disease. Whitty notes that infections classified as moderately serious, such as cellulitis, can substantially diminish an older person's quality of life. Such illnesses can restrict mobility, making social activities and even leaving the home difficult. Furthermore, bacterial or viral infections may raise the risk of stroke in older individuals, and some evidence suggests a link to a higher risk of heart attack or other cardiovascular problems. Infections can also trigger delirium, and severe infections are associated with dementia, though it remains unclear whether infections cause dementia or merely accelerate its onset. On practical steps, Whitty recommended basic personal hygiene and safety measures, thorough hand washing, careful food preparation, and advising recently infected people to avoid visiting others until they've recovered. He also stressed the tension between antibiotic stewardship and the heightened risk of sepsis in older people, arguing for a balanced approach that protects against antimicrobial resistance while not delaying treatment when an infection is likely to worsen. Professor Oren Akbar of UCL, who chairs the British Society for Immunology's Immune Aging Network, welcomed the focus on infection prevention and management in older age. He hopes the Chief Medical Officer's report will spur renewed research into preventing infection and improving outcomes for this age group, ultimately easing pressure on both health and social care systems. The report's scope is broader than just the elderly. It warns that the potential near elimination of cervical cancer hinges on maintaining HPV vaccination rates. It also notes concerning trends in vaccination, including a decline in uptake among pregnant women and a drop in routine childhood vaccination coverage, especially in London and among more deprived communities. Whitty rejected pessimistic claims that the UK is turning vaccine skeptical, noting that the downward trend in childhood vaccinations is largely due to practical barriers to access rather than a philosophical shift against vaccines. Additionally, the report documents a rise in imported infections, such as malaria, over the past decade, underscoring the importance of maintaining the UK's expertise in infectious disease prevention. Looking forward, it argues that pandemics are not a matter of if but when, and that preparedness should scale up between events rather than relying on reactive measures when a crisis hits. Whitty concludes with a call to strengthen preventive capacity and response readiness now, so that when the next infectious threat emerges, the system is already positioned to protect the population effectively.